Nutrition, okay.
Hello, I'm Carolyn Gray and I'm back again. Today we're going to be talking about groups. We're going to be talking about the kinds of groups, the purpose of groups, and the population that groups truly can help. Well, ladies, gentlemen, today is the day. We're going to talk about groups. We're going to talk about what population, the top population, that group therapy truly helps. What comes to your mind when you think of group therapy? What population do you think of?
Addiction.
Yes. Why do you think of addiction?
Typically they're group-based.
They are so group-based. Of course you're going to have your individual therapy with them. And you know today you're even going to advance past group to neurotherapy. However, let's stay with group. Group therapy helps this population, substance abuse population. It helps them feel at ease. It takes away the shame, humiliation. They find out, even though they knew before they even entered the group, they know that they're not the Lone Rangers. They know it's universal. But they learn from each other. They heal from each other. And this is why group is so good for them. First of all, let's talk about the counselor. What is the counselor's role in a group? What's the counselor's role?
It's to really facilitate the group.
Is to facilitate the group. The first thing the counselor is going to have to do, the counselor is going to have to lead that group. The rules to follow. So have to. In other words, explain what the goals are in this group, along with the group. So don't let me throw you off. That counselor has got to keep it organized. Because during the stages of group, you're forming the group, then you're going to be in the conflict part of the group, because what's happening is somebody in the group is going to try to be the lead, and they're going to be challenging each other. You know, who can get away, who's going to lead this group, who can get away with this. They'll be challenging everybody in the group. See, that's the stage, that's the corrupt stage of the group. The counselor's got to keep it moving and keep it organized, even though the counselor is the facilitator. But these are the behaviors. The counselor's got to have that, because it's the counselor's ground. Once they get through that stage, they get to the cohesive stage, which is the working stage. That's the best part of the group, because they're working. I don't care if it's a substance abuse population. I don't care what population it is. When you get to the cohesive stage, that's the stage that matters in any type group. But again, being cohesive, that's the working stage. And of course, they can become so close that after they have worked, they have completed the goals, it's time to terminate, and there's the grief. Because they are so attached to each other. They become like brothers, sisters, whatever. They're so close, very good friends, that they don't want to leave the group. So what can a counselor or therapist encourage the group to do so that they can stick together? But what you can do as a therapist, when the group terminates, you encourage a support group. You do not have to be a professional to lead a support group. One of them can lead that group, two of them can lead that group, where they stick together. They exchange phone numbers. They can meet wherever they decide to meet and keep this fellowship going. That's what it is. It's a fellowship, but it's a good one. And they can keep it going on their own. They sure can. But the counselor has done her job when that group becomes cohesive and it's time to terminate. Well, I want to thank all of you for your time. I hope that you've enjoyed our discussion today on group therapy, and we'll see you next time. Thank you.